access them. I'll give way to my cousin.
Grateful to Honourable Member for giving way. She and I are members and officers of the All-Party Parliamentary Group for Afghan Women and Girls, and on the point of education and access to healthcare for women, we hosted a meeting last year with Dr Faraz, a former Minister for Health in Afghanistan, and he spoke very movingly about the case for medical care for Afghan women. But one of his key asks was more support in Afghanistan for women to be trained as midwives to improve maternal outcomes. I'm anticipating potentially some of the Minister's responses here. I know how challenging it is, but does she agree with me that this is something that we should be able to take away to discuss from a bilateral perspective?
I thank the Honourable Member for her contribution and everything that she's done as chair of the APPG, but also for a long time advocating for Afghan women and girls. I totally agree, and I'll come on to healthcare a bit later on my speech.
She's speaking very powerfully about aid and contributions. If I can just briefly mention the Global Polio Eradication Initiative. Polio could be eradicated, Madam Deputy Speaker, in the next 3 years, which would be an absolutely historic milestone for the world. But to do this, the UK Government needs to commit £50 million per year for the next 2 years to this initiative. Given how little we can do to support Afghan girls at the moment, this is one tangible action the Government can take. Will the Honourable Lady reiterate that call tonight?
Absolutely, and of course we were on the brink of eradicating polio, and it exists in very few countries, and to see it surge again in countries like Afghanistan risks so many development gains.
Before Christmas, again, the APPG, including the Honourable Member for Norwich North, met with the UNHCR Afghanistan representative. As we know, many people are returning to Afghanistan from Pakistan, Iran and elsewhere, and often they are from female single-headed households. So they're doing so with a degree of trepidation. My understanding from that meeting is that body receives no funding from the UK Government. Is that something that the Minister would consider looking at? Because that surely must be an item of leverage in those meetings that he's been describing in relation to UK officials.
Minister.
We are providing support to returnees from Iran and Afghanistan. That support is mostly funneled through the IOM. We have not yet announced our allocation of aid for Afghanistan next year, but we'll be, of course, coming back to this House when we are in a position to do so.
Can I also commend the work that Linda Norgrove Foundation has done in relation to the 19 female Afghan medical students that it brought to the UK to study at Scottish universities. That was really groundbreaking work between the UK and Scottish governments in relation to funding for their studies and also the visas that allowed them to come. There are very small numbers of individuals who would like to do the same. Could the Minister take away that request to ensure that we have that pipeline so that hopefully in the future those women can return to Afghanistan and provide the care that's required?
Minister.
I'm very happy to take that away, Madam Deputy Speaker, and I'll revert to the Honourable Lady.